right, I love my warm room.
She's a 7-year-old female spayed French bulldog, and she's here for vestibular symptoms that started in January 16th after a flight.
January 16th. Okay.
Yeah. Mm-hmm.
Is this where she stopped improving?
Correct.
So she hasn't gotten worse.
She hasn't gotten worse.
Okay.
Just the same.
Hey, come here. You're all right.
Oh, I'm so dizzy. Oh, I'm so dizzy.
Can't see your eyes again. You got no obvious nystagmus. Let's spin you around. All right, let me listen to her. Let's take her for a walk. She actually seems to walk pretty straight, actually. So we just looked at Fiona. On exam, it appeared that she had a right-sided head tilt, some mild listing to the right when she's walking, and when I tapped her right, next to her right eye, the blink reflex was also reduced. Based on those findings, this is pretty suggestive of right-sided peripheral vestibular syndrome. The reason I think it's more likely to be peripheral than central is that the palpebral response, that the nerve that controls that response actually runs through the tympanic bulla, and also the fact that she has no mentation changes, no other cranial nerve deficits besides that. She has intact postural reactions. So my recommendation here would be to do a MRI scan of the head. So that would include the brain and the, depending if we need to do a spinal tap, we can do that. But based on those findings, then we can sort of tailor the treatment to Fiona. So typically in these sort of cases that don't resolve all the way, or we're having issues sort of resolving it, or hey, it could be something else, my usual recommendation would be an MRI scan of the head.
Which, I don't know if the nurse shared with you already, if we could go the route of just trying a stronger antibiotic first.
I'm going to give you 2 weeks of the antibiotics, okay? I'm going to give you a few refills as well. If we see some improvement within 2 weeks, then we continue for, I'd say, 6 to 8 weeks.
Okay.
To sort of clear it out, and if it doesn't work, then we can sort of talk about maybe switching to something different or further investigation there.
Okay.
Has anyone seen my water bottle anywhere? I'm making more of an effort to drink more water.
Good. It's okay.
It was a gift. It was a gift from my Secret Santa.
Hey, you get to drink more water.
She gave me this, and she gave me a 24-pack of these. So like, I'm just like towing the line between self-improvement and self-destruction.
It's a balance.
So here we have Savage, a 5-year-old male-neutered American bulldog, coming in for vestibular symptoms, as we can see.
Yeah, notice when he's walking, right? Look at his front legs. They're almost like he's got almost like an exaggerated way of walking, almost like he's marching. You can see, from here, standing, he's sort of leaning to the right. He has a right-sided head tilt. His right eye looks subjectively, like his eyelid looks subjectively smaller. He's got definitely myotic pupils on both sides. I think his primary issue though is that circling and this posture that he's having on the left side. So I think there's something going on in the brain, based on the fact that he has these postural reaction deficits and the circling, and it's probably the front part of his brain that's most affected. I guess the other thing we can think about is also potential paradoxical vestibular syndrome, because the postural deficit is on the opposite side of his head tilt. That's also a possibility here, but I think with the circling, the visual field deficit, it's probably more likely to be something that is right front, cerebral cortex. It's Simon Kornberg here. The circling with the postural deficit, to me, that tells me that this is more of a front of the brain lesion. So it's a cerebral cortical lesion is the most likely here, just because the postural deficit is on the opposite side. Right. The other thing that's a potential here is, with the right-sided head tilt and the left side postural deficits would be what's called like a paradoxical vestibular syndrome. So it's like a vertigo, but it occurs from a very specific place where the brainstem connects to the cerebellum, and that could also be implicated here. But based on the fact that it's mainly circling, I'd be more inclined to think that it's a forebrain lesion, and maybe the head tilt is just a residual problem from something different. If we decide we're going to do the MRI, so I'm going to hold off on the prednisone until we decide whether or not we're going to do the MRI, because if we do the MRI and we find something like inflammation, we do a spinal tap. It's on the same matter. It's in the whole package essentially, and if we give the prednisone, that can also meddle with the results of the spinal tap. Okay. So if we're going to do the diagnostics, I'd prefer to do them and have them be as effective as the diagnostics be as effective and accurate as possible, and not be masked with the prednisone. If we decide not to go ahead with the MRI and spinal tap, then we'll start the prednisone again and we'll manage it with prednisone, and we can titrate that and see if we continue to improve. Okay, no problem. Yeah, so I think that's the way to go, especially because we did improve in the prednisone. Regardless of what it is, if we're improving with the prednisone, I think we should at least treat symptomatically to try to get, salvage at least the best quality of life for as long as we can, regardless of what it is.
And if you can get me an estimate by the end of today, it would be great, and I can probably get you an answer by tomorrow.
Perfect. Yeah, and I'll then we can schedule for next week. And yeah, that's perfect. So we're not going to be waiting too long to decide.
Thank you very much.
No, absolutely. You're a cute dog. And you're also not a fat beagle. Hey. Oh. Yeah, he seems pretty comfy. I mean, he's got a bit of tenderness on that left side. It's hard to tell whether he's resisting because he's not happy. Yeah. I mean, there's definitely a bit of discomfort there on that left side. On exam, he seems actually he's doing pretty well with the new meds.
It looks like I don't know if maybe night and day from the 2 days ago when it happened. He couldn't walk. He could walk, he could stand, but he couldn't. He wouldn't want to walk more than 2-3 feet, even when we put him to try to pee in the grass. He would just kind of stay there and not want to move. Yeah. And then today, I think maybe the inflammation went down, but
he seems pretty comfortable. He's jetting around, and he's moving his head. Yeah. And I don't get any back pain either. I guess the one sort of maybe pain that I can get is if I kind of press the left side of his neck. He doesn't yelp, but I can feel the muscle just tremble a little bit. So that could tell me that maybe it's under a bit of muscle spasm there, which could be caused by something affecting the neck. So typically, the most common cause of neck pain, especially in beagles, would be a slip disc. There's other potential causes. I guess other ones in a young beagle, like meningitis, would be the other thing that I would think about potentially. My recommendation would definitely be MRI of the brain at some point. And the neck, it's going to be good to know.
It's there, right? So if you're doing an MRI.
Yeah, if we're under anesthesia, we may as well do it.
Yes, I think we're comfortable with doing the MRI for both things and go from there.
Perfect, great. So give me a minute, I'll write up a quick estimate for it and go from there.
Thank you.
Absolutely. So we finished the MRI scan. So I'm not seeing anything in the brain that's concerning. I don't see anything that stands out as an issue. It's fitting more likely with idiopathic epilepsy. Yeah, we're going to do a spinal tap just to make sure and send that out to the lab. Also had a look at the neck as well, which also looks very, very normal. So we're going to do a spinal tap to rule out anything infectious, inflammatory that's sort of in the CSF. I'm going to likely send him home on some anti-seizure medications, create rest for now, and then we'll recheck again in 2 weeks and see how we're coming along.
Are you still have it on?
Huh?
You still have the mic?
Yeah, I was looking, I was like, did you leave a lens cap on? Has the lens cap been on the entire day?